Hi, my name is Arjun Panduri. I'm a current fourth-year medical student at Wake Forest, and I'm going to be talking about renal cysts. While solid renal masses are always concerning, renal cysts are usually incidental and benign. Ultrasound is the most commonly used modality to evaluate renal cysts because it is very good at characterizing cysts, it's inexpensive, and does not use ionizing radiation. It's also very widely available. On the top row, we see examples of benign-appearing renal cysts. On the left, there's a well-marginated anechoic lesion with no solid component. In the middle, we see a paper-thin internal septation, but an otherwise anechoic cyst. On the right, we see hyperechoic material, likely blood, layering in a renal cyst. On the bottom row, we see examples that are more worrisome. On the left, we see thick, irregular internal septation. In the middle, we see a mural nodule with hyperechoic speckles, possibly representing calcification. On the right, the same mural nodule demonstrates blood flow, which we can see with the red and blue colors on Doppler analysis. CT is also very commonly used to evaluate renal cysts. A renal protocol CT includes pre- and post-contrast imaging to assess for enhancement of cyst components. In the top left, we see water attenuation round lesions in the upper right kidney and lower left kidney, consistent with simple cysts. Interestingly, this patient also has a solid enhancing mass in the right kidney, which we can see with the top right image, which is consistent with the renal cell carcinoma. The bottom images are pre- and post-contrast. The pre-contrast is on the left and post-contrast is on the right. The cystic lesion in the upper right kidney demonstrates an area of enhancement along its medial margin on the post-contrast sequence, which is suspicious for renal neoplasm. When a cyst identified on ultrasound or CT needs further evaluation, MRI is the usual choice. MRI is typically the best modality for evaluating renal lesions, but it is much more expensive and less widely available, so it's usually reserved for second-line evaluation. On the top row, we see an example of a simple cyst, which is hypointense on T1. This is the left image. Non-enhancing, meaning that it does not become brighter on the post-contrast sequence in the middle, and very hyperintense on T2, which is the far right image. On the bottom row, we see an example of a worrisome cystic renal lesion, which is mildly hypointense on T1. This is the left image. And then with thick, enhancing internal septae, which is seen on the post-contrast T1 sequence in the middle. The internal septations can also be seen as hypointense lines on the T2 sequence on the right. Finally, I'm going to discuss the treatment and prognosis of renal cysts. Renal cysts are mostly asymptomatic. Symptomatic cysts, however, can be aspirated, though recurrence is common after aspiration. Here we have an intraprocedural ultrasound image from a renal cyst aspiration. The red arrow indicates the tip of the needle. Percutaneous alcohol ablation also has lower recurrence rates.